already calling ourselves the sanity check portion of the evening. So I'm going to start off by, kind of where are we now? And I think about, my last experience with my doctor, and it definitely involved a fax machine. And here we are talking about kind of cutting edge artificial intelligence. So, maybe you could just sort of comment on that. Like, how is AI going to fit into a system that's reliant on PDFs and fax machines and everything, all these analog technologies?
Sure. So first, let me introduce myself. Atul Butte. I'm at UCSF. We use fax machines. I have an e-fax number somewhere. It comes from my email.
Proud.
That's right. I'm not proud of it, but I do fax. So obviously, we need to computationalize. We need to computerize more in medicine. But to go this extra step of AI is another whole story here, right? Of course, we got to reduce the paper and things, and we're improving with electronic health records and all that. But I think going all the way to AI, so I'm usually the most optimistic person in a crowd, but even this has kind of gone over the top, so I got to demystify a little bit about AI. So we do use a lot of AI right now in medicine. If you come to the Mission Bay new hospital at UCSF, we have robots that actually deliver the meds to the floor. So these robots steer around people, they deliver the meds to the nurses. I mean, that's kind of all there. We do have some decision support for certain diagnoses in the Epic medical record system that people use. There are crude tools in pathology and radiology, but in some ways, these are around the edges. Is this going to replace doctors front and center in the next 5 years? I'm not really positive about that at all. I think, as some of the surveys show, obviously, I think we're not ready to get rid of doctors yet. But so we do use a lot of this already, but we also use fax machines. It's a process that's under transformation, right? Yeah.
All right, so one of my favorite quotes about AI is from a friend, Jordan Schlane, who described it as like a Band-Aid that we sprinkle over a broken system, which I love. And do you see it that way? Is that, do you see AI as sort of changing the system, or just like making small changes to processes that are so inefficient?
Yeah, so the first thing I really want to make sure this audience gets is, let's totally demystify this thing. You can go on Amazon tonight, I just looked, and buy Machine Learning for Dummies. It's $20.33, and it's actually Amazon Prime, so you'd have it by the morning, right? So it's a way of writing software that has certain characteristics. And typically in AI, we have two different ways of doing this in general. There's supervised and unsupervised. It's not like unsupervised is Arnold Schwarzenegger in The Terminator. That's not unsupervised. So supervised means I have a right answer. I know this is supposed to be called this, and that's supposed to be called that. But I've got all these other measurements. Can I come up with a way to make that decision more efficient? Unsupervised means that I don't know what I'm looking for. I don't know if it's right or wrong. Help me find some patterns here. And that's really what AI is. It's nothing more mystical than that. It's a way of writing software to either look for patterns or to help you get to right decisions. And so what you apply it to is the hard part here, right? What are the questions you need help with? Like one of the other speakers said, there's plenty of people who have AI platforms right now. This is Silicon Valley, but they're struggling to figure out what the question is. We in medicine, we have lots of questions, but that connection doesn't happen efficiently enough. So I recommend all of those startup folks to go to medicine, to go to doctors, figure out what the unmet need is, because the platform by itself doesn't go that far. But is it a Band-Aid for medicine? I think there are a lot of side edges. We're going to get images detected better. We're going to get the radiology to get diagnosed a little bit easier, more efficiently. But I think, the analogy I use the most, let me just, because I can barely see the audience here, I'm going to make this a little bit interactive for a second here. How many of you drive a car? Okay, let's see. Yeah, so that's about the entire audience. When the check engine light comes on, did you know under the dashboard there's a standard cable called an OBD2 port? It's a standard in the United States. How many of you have bought that gadget that diagnoses your car by yourself? 1, 2 hands, okay? 3 hands.
Not the gadget, I've done much more interesting
So you've even changed your oil. The rest of us don't even know where the oil cap is anymore, right? The rest of you, do you go to an expert to change your oil? Show of hands, right? Yeah, so why is that? We have the gadgets, the thing even diagnoses itself, but we'd still rather go to an expert because we're working 80, 90-hour weeks. We just want someone to deal with this problem, right? And so in some ways, there are going to be people who diagnose themselves and figure out themselves, and then there are going to be these experts who just take care of this problem for us quickly, right? And maybe that's what medicine's going to be like.
So it'll be like the accountant question.
Okay, the other analogy is tax, because we just did tax season. How many of you hired an accountant to do your taxes? It's usually 50-50 here, right? So this is about A third of the audience, how many of you use TurboTax, TaxCut, any software to do your taxes? The rest of you are not filing your taxes. I'm not sure why. The IRS should be here. Maybe you've delayed your taxes like I have. Usually it's 50-50. Again, if your life is simple, you use the software. If your life is complicated, you probably find an accountant. The people who are healthy probably have no problem with software. I mean, it's kind of fun. It's kind of easy. The minute you're sick, you kind of want an expert to kind of deal with this headache for you.
So a thought here, especially after listening to Ray, who really deeply understands this issue, and he hinted at some things that are very obvious to him, but we tend to sort of surf over it as we're looking for short-term answers. First of all, I'll offer you a prediction. I will predict there is an absolutely infallible Turing test for a robust AI that will utterly replace a doctor. And the way you know the machine has passed the test is when it delivers its answer, you will not be able to read its handwriting. But beneath this is an issue that is deeper than healthcare. And that is, what does the phrase AI stand for? I teach at Stanford, and this was actually a debate conducted in the early 60s between two individuals, John McCarthy and Doug Engelbart, and actually very nicely documented in a recent book by John Markoff. And John McCarthy, who coined the term AI, artificial intelligence, in 1958, said this was creating intelligences that would replace human beings. Doug Engelbart looked at all the same trends and the same technologies, and he said, no, AI stands for augmenting intelligence. And if you think about the sub-conversation this evening, it has been, do the machines replace human judgment, or do they augment human judgment? And that's something we should all take home after this evening and ask ourselves, what kind of world do you want to live in, where the machines replace the human judgment, or do they just make us better humans?
I think that's a really key question that came up earlier is AI going to replace or assist doctors? And this has been a famous debate that has raged in the press.
We hope it'll replace the lawyers.
The lawyers, just the lawyers. Maybe we could talk about doctors specifically. Like, what do you think the sort of specialty areas are within medicine that we might see AI being a more natural fit?
Yeah, so I think certainly the fields that are already digitized, that are simple pattern recognition, let's strike the word simple. Let's say pattern recognition. I think are going to be the first to get replaced. So I think radiology and pathology, which used to be some of the hottest fields for people to go into in residency after medical school, I think are going to be the first to get hurt in this.
Well, of course, radiologists are the Rodney Dangerfields of medicine. First they got offshored to India, and now they're being reshored to computers.
That's right.
You know, a general pattern here. So I'm involved with our Center for Advanced Study at Stanford. We just finished a big project on the future of work. A real simple way to test whether any job is in danger, that includes all of our jobs, is not how much expertise you have, but what percentage of that work involves routinized pattern matching. Yeah. So a radiologist is highly skilled at a very specific routine. The weirder your job is, the less repetitive it is, the safer you are. So the docs that are safest, ironically, are the general practitioners.
That's right. Yeah, absolutely.
They still won't get paid anything, but
that's right.
They're safe.
Okay, so you mentioned the golden word, which is pay. And this is an important one in healthcare, which is like the one industry where if you build cool stuff, it doesn't necessarily mean anyone's going to come.
That's right.
So can we talk about who's going to buy this? Like if we've got great diagnostic technology, medical imaging and so on, like who's going to pay?
Yeah, so first of all, I mean, there's a lot of money in healthcare. Obviously, we're close to 20% of GDP. We don't spend that much on movies like Netflix, right? So this is a huge industry.
But Hollywood's a lot more efficient than healthcare.
Well, I don't know how efficient it is. I've seen terrible movies on United. I'm not sure how efficient the Hollywood industry is, actually. So they have mistakes, too. But who's going to pay for it? I think, again, you have to go after unmet need. So obviously, we have this kind of dynamic where they're payers kind of against providers, healthcare providers, those of us docs, for example. And so people are trying to figure out ways to make that process more efficient. The payers certainly have a lot of data analytics going on. And many of the payers have subsidiaries that are looking at their raw data, the claims data. We as providers are just starting that type of effort. The University of California, we're organizing our 15 million patients that get care in the University of California. We're trying to learn from our patients, predict what happens next. So we know that this is happening too, but in some ways, the flow of the money is kind of one big reason, business case to organize here, right?
You know, every time digital technology hits a field, it leaches the profit out of the establishment. It's what personal computers did. Ask a cab driver with Uber. The same thing's going to happen here. This is a revolution. The big parts are going to come from the bottom. It's the startups out at the edge delivering products to individuals. The sensor revolution in health hit first with biosensors for runners and single guys who wanted to get a date, and they'd show their data, you know, and say, hey, look, I've got a resting pulse like Lance Armstrong. I'm a great date. It's going to come in from the outside, and the medical establishment is going to play catch up.
I have to disagree. So this audience doesn't
you're a
even
doctor,
change
you
their
have
own
no
oil.
choice.
But they don't even change their own oil, right? I mean, so how much do you think the public wants to do themselves? If they're healthy, I totally get it, right? I myself haven't seen my doctor in more than a year. My wife will kill me for that.
The early
here.
market is
but
the
so
worried
the sick
well.
ones are different, right?
No,
I mean, that's
the market's the worried well.
Yeah.
And the bio-curious.
There are still problems in computer science that computers cannot solve, okay? For example, the famous one's called the traveling salesman problem. It's kind of deceptively
Actually,
simple,
AT&T
right?
solved that with the
But
car
not for
marker.
millions of capitals,
With the
right?
car marker algorithm in 1997.
So,
Ray, would you help me out here?
but if you put in like 10 million capitals, you still can't solve the problem because it's exponential, right? So there's still problems that computers in general, unless there's a trick, they have to try. Unless you're denying NP-complete algorithms here, you know in general, there are algorithms that still we have to try every possible combination. That will eventually get too hard here, right? If you think this is esoteric, so my wife took Uber Pool from the San Francisco and King Street station to here and went backwards a hell of a lot.
I will
company,
grant
right? So,
there's a Nobel
so
Prize.
it doesn't know what it's doing here, right?
To the person who answers the question of whether
Right.
P equals NP,
Right.
there'll be a Nobel Prize. But in the
Beyond
meantime,
Nobel Prize.
Uber gets me to my destination a lot faster than
Okay,
cab companies.
I think we
I
should,
agree.
I've got one more question about healthcare, and then maybe we can return to Uber. Okay, healthcare. Most important word for me here is care. And I had my first AI fail, I think, last week with my doctor. I got, I think it was the first time ever I got emailed by my primary care doctor to say, how are you? Just checking in. It was amazing. I almost fell off my chair. But I immediately responded back and I said, oh, I'm fine. And I got a vacation responder, which suggests to me that it was probably not sent by my doctor. It was within seconds. And I looked again at that email and realized that it was completely automated. I'd been fooled. So, how do we ensure that things like this don't happen, where we start to, bring in sort of AI to replace this human connection, and patients don't just feel further pushed out of this system?
So it doesn't sound like you have a relationship with your doctor. You should change doctors.
And they're better ones.
And, we're tempted to automate the wrong things first. And so we say, gee, how can we pretend to make, the fact that there's a relationship here based on time? I think one of the most intriguing things about this is, can we use this technology on the back end to create the kind of efficiencies that allow doctors to get back to what they always have done in the past, which is have a real long conversation and not be looking at the clock. Like at Stanford Medical Center, the docs are absolutely on a clock. And to put in the kinds of efficiency that a marvelous doctor like this can sit down and have a long conversation with the patient, not to create,
Look, let
phony
me try a different way, right? We're not done yet in medicine, right? So I can understand the road from here to LA hasn't changed. We know 1,000 different ways that bad drivers can cut you off. I can imagine a car that drives me there, right? But we're not done in medicine. There's so much more left to discover. We have new drugs still being approved by the FDA, amazingly. We still have to learn how that works. The biology for any of these diseases still isn't explained. I'm not sure we understand everything left in medicine. Sometimes you want to have someone explore a disease with you, especially if you're one of the ones with the rare diseases that no drugs exist. You need someone to just walk with you to get to those therapies. I'm not sure AI is actually going to do that.
All right, well, we leave you on a pro-human note tonight. Thank you so much.